we did the hiatal hernia maneuver on him, and only once. And then he had a endoscopy in September done a couple weeks after this one.
Right.
So a few weeks after we did the hiatal hernia maneuver and release, he went and had an endoscopy again, and
they saying it's not there anymore.
Hello folks, so we have another case here of CostoChondritis, okay, and a hiatal hernia. So these are two conditions that are very difficult. People have a very hard time finding the right help for this. So he originally came in to see me for CostoChondritis, mid-back pain, headaches.
Right.
We're now on our fifth treatment.
Fifth treatment.
And the headaches, how are those?
Headaches are much better. Not too much headaches.
Okay.
Not too much headaches.
Headaches.
And the pain in the chest area was like all over. Now it's just like maybe like just in the sides I'm feeling it.
Okay.
So the last visit really helped me.
So 60-70% improvement?
70% I would say.
Okay, so about 70% improvement in 5 visits on the CostoChondritis. Not everybody gets results that quickly. It depends.
Absolutely.
Case to case, it's different.
Yes.
But what I wanted to go over was his hiatal hernia. He had a hiatal hernia diagnosed many years ago by an endoscopy. And that is the best way, most definitive way to diagnose it. Now, on August 28th, we did the hiatal hernia maneuver on him, and only once. And then he had a endoscopy in September done a couple weeks after this one.
Right.
So a few weeks after we did the hiatal hernia maneuver and release, he went and had an endoscopy again, and
they saying it's not there anymore.
No more hiatal hernia.
No more hiatal hernia.
So a lot of people have a question as to whether or not the maneuver can correct the hiatal hernia. Yes, but the hiatal hernia can come back due to stress, poor posture, and that's what we're looking at. His posture is kind of bent over.
Yeah.
That's what we're going to work on now. We're only on visit 5, but we got to work on that with him. So the hiatal hernia.
We're getting there.
Yeah, so the hiatal hernia doesn't come back, but also so the costochondritis doesn't come back.
Right.
So let's go ahead.
Better than
and
medication. Taking all that medication because medication is bad for the kidneys. It's only anti-inflammatory they're giving me
and the liver too, not to mention other parts
so you
of the body.
don't want to be on too much medication. You want to do it the natural way.
So go ahead and lay down on your stomach. We're going to show people how we address this here. First, we're going to loosen his paraspinal muscles along the thoracic region here. We just gave him 10 minutes of heat also, so that helps to bring more blood flow and relax the muscles as well. I'm going to be honest here, if you just work on posture and correcting the thoracic spine here and rib adjusting, the costochondritis can probably improve 50, 60, 70%. But there are a lot of people with severe cases and like him who, they're just not going to get that 60, 70% improvement just with manipulation. And I'll show you what our secret sauce is in just a minute. What we use that's very, very unique, and it's really what's calming all that inflammation down so quickly. He said after his last visit he completely turned around and improved, and I'll explain why in just a second here. Go ahead, take a deep breath in. A little bit sensitive right there?
Yeah, a little, yeah.
And right there?
Yes, sir.
And a little bit
And
right
there,
there. Okay. All right, turn over on your back. And cross your arms in front of you. Okay, tuck your chin down. So what I'm doing here is a rib head adjustment and a thoracic adjustment, and relax here. And the first time he had this adjustment, and head back. The very first time you have this adjustment, it almost feels like the wind is being knocked out of you, right?
Yes.
All right, go ahead.
But then you feel a relief.
Yeah, but at first, while it's being done, it's a little intense the first time. Go ahead and put your shirt up.
Sure.
Okay, ladies, calm down. Okay, we'll leave his phone number on the bottom here if you want to get a hot date with Mohammed. This is the secret sauce. This is the Multi-Radiance Active Pro with laser stim. This is a cold laser, and this is what's really helping him progress quickly. Okay, we're going to start right around here. You're going to go right down, and then we're going to go in that spot.
Yeah,
You want to start right there first. Okay, so I want you to hold that in place. Yep, just like that. So this is a 50-watt laser. We're going to put this on for about 60 seconds in each spot. And that's all it takes. We also have rental lasers that we rent out to patients. I don't think we're going to need to do that with him. So, but that's also a possibility for people that are elderly and more susceptible maybe to coronavirus and a little worried to come into the office. That's an option. Again, about 60 seconds here. Just going to check the timer.
What's crazy is people think it's just medication that's going to help. You know what I mean? And it's not. There's a natural way. You know, coming
well, medication, all the medication does is it's going to treat the symptoms, right, of inflammation and or pain. Right. But just a new study came out this morning that for pregnant women not to take NSAIDs, non-steroidal anti-inflammatories like ibuprofen and Tylenol. Tylenol is acetaminophen, but you know, and you have ibuprofen, you have several different types, Advil, Aleve, and they're warning people, especially pregnant women, from taking that while they're pregnant because it's been linked to kidney problems in the children. So they're not good for you, and they don't get to the cause of the problem. All they do is address the symptoms. So what we're doing is we're addressing the cause with your posture and aligning the spine and the ribs, and then we're treating also the inflammation. Okay, so we are treating the symptoms as well, but with this laser, and we're doing it naturally. Okay, and we're going to go over to the other side here, and is that it right there?
There you go.
Okay, and hold it right there. And right there. Okay. And that's your pec minor muscle right there. So you're sore where your pec minor muscle is, and that muscle pulls your shoulders forward and down. So as we start to laser this, you're going to start to see that you can pull your shoulders further back up.
Okay.
Okay, we're going to go over a good stretch today. I know you have already done some stretches that I've given you, right?
Yes.
How are you doing with all those?
I'm doing, you know, as much as I can. But I see the difference, though.
Have you done the video of the 22 CostoChondritis exercises and stretches?
No, not as of yet.
So I did a video, 22 exercises and stretches for CostoChondritis, and there's a lot in there, enough to keep you busy for the whole year.
Oh, yes.
So I'll send you the you know, an email with a link in there so you can get started on those. Okay.
Okay. Every little bit helps.
Yeah. And hold that right there. So now we're going to get right into the joint where the ribs attach right into the sternum, the costosternal joints, which is originally where he had a lot of inflammation and pain. And we're just going to spend a few minutes calming that inflammation down. Okay, so we go ahead, we laser here, and this is really the secret sauce for CostoChondritis. This laser is so effective for CostoChondritis. I have found nothing else that's more effective than this. I got you. You can just relax. So next we're going to adjust his cervical spine, the neck, And we're not going to do the hiatal hernia move because we've done it 4 times and we already know that it's been corrected because he just had his results back from his endoscopy. And you can hold that right there. Good. You said you haven't had a headache, right, in the last week? No, 2. Good. So you feel that right there?
Yeah.
I'm going to correct that. You have a subluxation here at the very top of your neck at C1. And this can certainly create a headache at a later point, if not corrected. It's really great news though about the hiatal hernia because that can be really uncomfortable.
Yeah.
And as you know.
And it's like because you asked me that day, you know what I mean? It's not like I was just concentrating on the chest area. I wasn't. That's why it's good to have a little medical history, right?
Medical history is one of the most important things. Absolutely. It is, if not the most important thing. Absolutely. Yeah. Okay.
All set?
You're all set.
All right.